think clinicians wonder, like, when do you build the treatment plan and what do you do? Like, how do you do that? Are you staring at the camera still? Do you turn your camera off for a minute to put your thoughts together and build that out in writing? Do you do it after the patient leaves or that visit is done? Some of these like strange, nuancy questions that, normally a doctor might step out of the room to look something up or to check on a product ingredient, or how do you do that in a virtual setting?
Yeah, I'm just pretty transparent about it. And, you know, if there's something I need to look at that's going to sort of pause my attention with the patient, I'll tell them. I'll say, if they introduce a supplement to the conversation and say, oh, I got this one and I'm not sure, I'll say, well, let me look it up. And then I'll look it up and I will talk through it with them. I'll say, okay, it looks like it has X, Y, and Z in it, and so, and either that looks good or maybe not, don't use it. If there's a more complicated issue that I'm not familiar with medically, I might look it up on UpToDate or natural product, standard database, and I'll tell them that I'm doing that, and I'll, either read it quietly while they're waiting or even talk my way through it with them. And then in terms of, finalizing the note and the treatment plan, it's a dream/goal to have that note completely finished by the time that appointment is over, so that there's no cleanup to do on the back end. And I don't always get that done. I try. It's always my goal because it just makes my day so much saner if I don't have to go back and do cleanup. What I do get really, really good at is anything that's going to require me to remember, because I'm just dealing with so many patients and so many different things. I'll get all that down. And then I might, I also have a little sort of, piece of paper and a pen where I'm taking notes next to me, and I'll make sure that all my notes on what I want to do are intact and ready to transfer over. And usually I'll get most of that entered during the visit, and I'll just say, hang on one sec, let me just write this down, and I'll talk as I'm typing. I'm not a very fast typist, so it's not like super ideal, but I'll tell them what I'm telling them. So speak the plan while I'm typing it out. And I think that's just a nice sort of reinforcement for them. So again, just get as much information into the EMR when I have them on the phone or on the call. It's working time, and that's what they're paying for. But there sometimes is a little bit of cleanup that I have to do post-visit.